In our very first YouTube video, and the first in this series, Pathology, we'll discuss growth adaptations. Before we begin talking about the different growth adaptations, let's take a minute to talk about the physiological state of an organ. Now, an organ is considered to be in homeostasis when the stress is physiological and the environment is in optimal conditions. Parameters such as temperature and fluid balance are important, but also electrolyte balance and nutrient supply. The organ will always attempt to maintain homeostasis, and changes in stress may cause the organ to undergo growth adaptations. So let's take a look at the different growth adaptations and their characteristics. Let's say that we have an organ that is experiencing an increased level of stress. We know that when an organ is under higher and higher stress, the organ will undergo changes and increase in size. Generally, there are two ways an organ can increase in size, and when possible, these adaptations happen simultaneously. The two mechanisms are called hyperplasia and hypertrophy. Hyperplasia is a response to an increase in stress and involves production of new cells from stem cells. The organ increases in size by increasing the number of cells. Hyperplasia is not always possible though. Permanent tissues such as cardiac muscle, skeletal muscle, and nerve cannot form new cells. Now, these tissues will undergo hypertrophy in response to an increased level of stress. Hyperplasia, if left untreated, can eventually progress to dysplasia and cancer. A notable exception, though, is benign prostatic hyperplasia, or BPH, which does not increase the risk of prostatic cancer. Hypertrophy is the other process that occurs with increased level of stress and involves gene activation, protein synthesis, and production of organelles. Here, the organ increases in size by increasing the volume of the individual cells. However, the total number of cells stays the same. To give an example of hypertrophy, cardiac myocytes will undergo hypertrophy and not hyperplasia in response to systemic hypertension. Great, we've covered the basics of hyperplasia and hypertrophy. Now let's look at what happens in response to a decreased level of stress. To give you an idea of what I mean by decreased level of stress, this could be, for example, decreased hormonal stimulation, disuse, decreased oxygen, and decreased nutrient supply. An organ responds to this by decreasing the organ size, and it can be achieved either by decreasing the size of cells or the number of cells. A decrease in size is accomplished by marking cellular components for degradation, a process known as autophagy, meaning self-eat. A decrease in cell number is accomplished by a process known as apoptosis. Alright, now what if we don't look at the size and numbers, but rather the morphological changes of an organ in responses to changes in stress? We call this process metaplasia, and it typically occurs in surface epithelium, changing from one type to another. This change occurs because the metaplastic cells are better capable of handling the stress. A great example of this is Barrett esophagus. The esophagus is normally lined by stratified squamous, non-keratinizing epithelium, a tough surface epithelium that is well suited to handle friction as we eat. However, in case of chronic acid reflux from the stomach, these stratified squamous non-keratinizing cells undergo metaplastic changes in order to handle the acidic environment. They will undergo morphological changes from squamous to columnar, with interspersed goblet cells producing mucin. It's important to note that metaplasia is reversible, but the driving stressor will need to be removed. In this example, treating the gastroesophageal reflux. But just as metaplasia can return to normal, it may also progress to dysplasia and cancer if the stress persists. Referring back to the Barrett's esophagus, it may progress to, for example, adenocarcinoma of the esophagus. Now, you've heard the word dysplasia a couple of times in this video already, so let's find out what that means. Dysplasia, translated from Latin, means bad formation, and is basically a disorder of cellular growth. Dysplasia is a proliferation of precancerous cells, and as it progresses, it may lead to carcinoma. A good example of this is cervical intraepithelial neoplasia, or just cervical dysplasia. It's characterized by abnormal growth of cells on the surface of the cervix, typically in the area of the squamocolumnar junction. It's linked to HPV, and a small percentage of cases progress to cervical cancer if left untreated. Now we're almost done, but we have two more easy to go. Aplasia is the failure of growth during embryogenesis. So for example, in case of unilateral renal agenesis, in which a newborn is missing one kidney. Hypoplasia is a decrease in growth, however present, during embryogenesis. An example of this is streak ovary in Turner syndrome. Now these ovaries don't develop normally. They're relatively small and usually caused by genetic problems. That's all for this time. I hope you learned something, and thank you for listening.